The 21st Congress of the European Association for Craniomaxillofacial Surgery was held from September the 11th to the 15th, 2012 in the medieval city of Dubrovnik at the Adriatic coast of Croatia. The Congress venue was at the Valimar complex located in Babančuk Peninsula, a pleasant and quiet area 8 kilometers from Dubrovnik's old town. Almost 2,000 delegates coming from 64 countries worldwide were present at the Congress. Within the conference centre, a large multi-purpose area was used to allocate the registration desks and the different Congress offices. The faculty was represented by 107 speakers invited from all over the world. The opening ceremony was held in the heart of the old city at the Rector's Palace.
Ladies and gentlemen, colleagues and friends, it is my great honor to welcome you today on the occasion of the 31st Congress of the European Association of Craniomaxillofacial Surgery. You have received your t-shirts. You know what's written on them. Use them here in Dubrovnik. You will not operate here. This is time to exchange your knowledge, to talk with your colleagues, to meet old friends and to make new ones. Enjoy your stay, enjoy Dubrovnik, enjoy the Congress. Thank you.
I would like to greet and welcome you in Dubrovnik, the city which, having introduced the first quarantine isolation in the 14th century, has given its great historical significant contribution to promotion and development of health culture and health care in Europe. I welcome you once again and wish all participants a pleasant stay in Dubrovnik and fruitful work and scientific work on the Congress.
The audience was welcomed by the Dubrovnik city rector, as in ancient times.
Concedatur hospitibus ac in civitate honorabili comorandi facultas quambiu voluere.
Da se gostima dopusti boravak u ovom slavnom gradu, dok god oni to pustite budu.
That our guests be allowed stay in this famous city for as long as they desire.
Obligamus eos ad nostras leges et consuetudines collendas.
We bind them only to respect our laws and tradition.
Nobis tenac dosre.
We welcome you.
The social events included The Imaginary Sickness by Molière, performed by Croatian actors,
Jer mi dobro opero servičeškoca na juče učinio. Je li bilo dosta fleme i žutila?
the Dubrovnik local dance called Linjo, as well as the ballet group Sorrow. The Congress was dedicated to John Lowry, Secretary General of the Association from 1998 until his death. A tribute to John Lowry was presented by his wife and daughter and his colleagues who have worked with him for many years.
Thank Professor Vera of the European Association for Craniomaxillofacial Surgery for the generous invitation to my mother and I to attend this Congress. It really is such an honour that nearly 4 years after an untimely loss, that we are still hearing tributes to my father and his work.
I've had the privilege to work as John's assistant secretary for 10 years. When I think of him, several memories spring to mind. The first is his humanism, his joy interacting with others, his positive attitude, not forgetting this mischievous spark in his eyes.
Professor John Lowry was born and educated in England. He graduated from the University of Manchester in dentistry and in medicine, obtaining the fellowship in dental surgery of the Royal College of Surgeons of England in 1968.
It seems to me like yesterday when in 2002 I was nominated junior president in Münster. As I said during my opening speech at the Executive Council, my presidency would not have been the same without you.
John was a kind of a long-distance runner. He worked tirelessly for his profession, his patient, and cared lovingly for his wife.
However, one and all remembered John and the inspiration and guidance he had offered them in the early days of their careers.
So I'm going to add a few of my own personal remembrances of John, for he and I worked together probably longer as a pair than any other than Moira and the teams around the 4Bs in his clinical work.
Dear colleagues, I would like to give a bit different picture of John. A picture of John as a friend and as a sailor.
The pre-Congress events on Monday started with the journal publishing workshop, How to Write and Publish a Scientific Paper, given by the Elsevier team.
Well, I think the original idea was possibly discussed at a previous EACMFS meeting, that it was something that the journal, the publishers and editors could provide that might be helpful, especially for the trainees.
The submission rates have increased dramatically from nearly 200 to more than 600 over the last 4 to 5 years.
The other thing is, I think trainees very often put off submitting to a journal because they think they have to be a high-powered paper, lots of scientific content, and are not sure exactly how to go about it.
So to highlight the participation of our trainees to the Congress.
The John Lowry Trainee Day on skin cancer was covered by a series of lectures given by Michael Virag and Ian Jackson.
Many of them are operated, but it's very bad if you put a huge graft or
Cheek from the cheek, as you might say. And this gives quite a nice tongue flap. Tongue flap is something I like doing very much because it's great material inside the mouth.
The product training courses were as follows. The first focused on image-guided craniofacial reconstruction and was held by the Brain Lab faculty.
Through the planning of the mandible situation, so if you go for reconstruction after the implant and in radio dense, the result of the mesh which was inserted into the orbit, because there was a big exophthalmos, but
case you will plan later on your work on your laptops, the orientation of the patient is in the right position.
The second was the Mactron teaching seminar, Piezo Surgery, Use and Benefits in Maxillofacial Surgery, held by Daniel Hrusak and co-workers.
7 days after surgery, 21 days after surgery, 42 days after surgery, the animals were sacrificed in order to have a closer look on bone healing. Again, our model.
The day ended with a trainee party at the beach.
different elements, different partners, different components of our specialty gather. This venue in particular, in Dubrovnik, I think has been the most successful Congress, as it has been extremely well attended in an outstanding venue, and I have to congratulate the organizers for the quality of the running of the Congress.
There were 8 keynote lectures given by prominent experts from all over the world. The lecturers were James Brown from the UK, Luigi Klauser from Italy, and Rafi Nagler from Israel. Henry Kawamoto, Ian Jackson, Jatin P. Shah, and Edward Ellis from the USA.
Of longevity go hand in hand, and an ideal line. Because of this change, and because of the increasing impact of therapeutic interventions by non-surgical means, the trends in management of other cancers, which you folks don't treat, but you do, cancers of the larynx and pharynx, which most head and neck surgeons treat, have changed. It is not the strongest of the species that survive, nor the most intelligent, but the one most responsive to change. Thank you.
James Brown is a very well-known surgeon.
So you're always thinking, when the pathologist presents your resection specimen at the NDT, you're thinking, I hope I've achieved what I set out to do, and often we don't, especially myself and our team. And so in their theme, sorry, I'm putting up rather on data, you don't have to look at it all, but basically the theme, we really just want to know where there's arterial failure, because that's a lot more difficult to pick up than here. You see, I like this slide because all this lot over here are the important people.
The lecture on the Dubrovnik city-state and its history, culture and medicine, while not part of the profession, was also interesting and given by the internationally recognised historian Ivo Banac.
This process continued well into the 15th century until the Slavic element prevailed. Its inhabitants were called Lausans. That is, those who live on steep cliffs. And this is an important fact in Dubrovnik's history, destroyed in the earthquake of 1667.
I think that this Congress will be a landmark in the history of the association because of the quality of the scientific program, the quality of the speakers, and really the attendance.
There were 10 meetings with the guest societies. The Spanish Association of Oral and Maxillofacial Surgery covered the panel Controversy in Management of Fractures of the Face. The chairman was Rafael Martin Granizo from Spain.
We suffer right now. Maybe it's a major problem and we need to pay attention to this. In medicine, especially in surgery, we have the habits of classifying. As I told before, open treatment is reserved to the situations that there are.
The panel on orbital trauma and reconstruction, moderated by Warren Schubert, was given by the American Society of Maxillofacial Surgeons and has raised a lot of interest among the audience.
Down to reattach the lateral canthus arch. But I thought, I'm a smart guy. I read Whitnell's original paper, and he claimed that if you measure the distance from the intersection of the zygomatical suture down to the lateral canthus, it was 11 millimeters. That's what he measured, that's what he published.
The panel on rhinoplasty was given by the American Academy of Facial Plastic and Reconstructive Surgery.
So that's giving her
An interesting panel on surgery first, orthognatics for mandibular prognatism was given by the Korean Association of Oral and Maxillofacial Surgeons.
The occlusion to minimize the post-operative occlusion interference. My orthodontic colleagues and me usually add the resin or a skeletal anchorage system.
The 800 square metres space of the Congress exhibition area provided many opportunities for networking amongst the medical professionals. There were 6 panels with the international faculty. Panel on research, craniomaxillofacial distraction osteogenesis.
Entirely different than what you end up with. You can't be afraid to say what you're thinking. And I use the example here as a telephone game. And what you do is we have 50 people lined up in a row, and the first person tells the second person a statement.
Free flaps for head and neck reconstruction.
They realize small changes to color, texture, blanch, and temperature can be significant indicators of the health of the microvascular free flap. And of course, they realized probably some disappointments before, because previous microvascular free flaps have previously been lost.
And thank you for to the European Committee who invited me here. Facial paralysis is a very bad disease that in a few hours the person to the loss of his face, of his morphology. And you can see immediately, postoperatively, that the lower half of the face is not working, and he also has a paresis of the upper part.
Sometimes the perforator also originates from the superficial femoral artery. So the anatomy of this perforator can be quite the very advantage of these flaps is that you do not need to thin them out. Now the soleus perforator flap. Soleus perforator flap is well known to everybody.
Where do you attach the monitoring system? Do you attach it to the skin or do you attach to the vessels?
We are still working to use this tool for buried flaps.
With a static procedure with eyelid whites, if you combine this with the dynamic procedures, or do you use this procedure sometimes?
What we've often noticed in our patients is that they're too heavy and it becomes too bulky.
My problem is that I cannot do reconstruction of the floor of the orbit with the osteotomy of the free flap.
Thank you that you attended this session.
Consensus and controversy in cleft surgery.
Dear White speakers and dear colleagues, it's a really honor and pleasure for me to open the consensus and controversy in cleft surgery.
The protocol that you see in the slide was the mostly employed in Europe in this period. Was the Svekiendiek procedure in 2 stages, with a hard palate repair, retarded at 6 years about.
Next speaker is Professor Brian Summerlin.
I work at Great Ormond Street Hospital for Children. It used to be called the Hospital for Sick Children in London. This is a very early drawing of the hospital. Those of you who saw the opening ceremony of
facial transplantation.
I know all the answer, of course, but I'm very interested to learn about that as you.
On the external carotid arteries and on the thyrolingual facial veins, the mandible of the recipient, the after, without any bone grafting. It's pretty good, but the patient
working on different combined cases which are applicable to the clinical transplantation.
Being for organ transplantation and transplantation of tissues.
Our host, Professor Barak, for the kind invitation, and for Professor Luigi Clauser, who made this possible for me, and lastly, Professor Sylvie Testerling for including me in this panel. So it's built on clinical success of a team and an institution with a patient need.
Cleft treatment around the world.
Also straight line. On the routine cleft lip surgery treatment, there were no pre-surgical nasal modeling and no primary nose correction and no extensive muscle dissection.
I think this meeting is very important for our society. This biannual meeting, it gives ourselves an identity. It's like with a face transplant. We are all individuals. We are belonging to one group, but every second year we come together, we have a nice interactive meeting, both scientifically, socially. It creates actually the identity of our surgery.
During the Congress, the excursion to Elefiti Islands was a great place for socializing and the enjoyment of the Adriatic coast. "24 masterclasses were presented by the international faculty. Almost 1,000 presentations were presented. Oral presentations were presented in 42 sessions, covering most of the field of maxillofacial and head and neck surgery.
Inside, important jaws asymmetry may cause disturbances in physiological activities in coming.
But it doesn't have any of the trainees' registration details. And if you're going to put somebody onto a website who's a medical professional, you must have their GMC and their GDC registration details actually on the site. But they're not, I know they're not there because I've looked.
All what they want a picture of the person they are going to see in the clinic. And all.
I think that only to is 10% of people, of patients, thinking that the websites are more trustable than the doctor's opinion is. Yes. I think is can you explain?
Most bridges over the rivers were closed, the traffic was in gridlock, there was liquefaction. That's when, because of the shaking, the ground breaks up in little bits and water comes up.
All insurers were established methods, the way we changed things was the post-operative recovery and rehabilitation schedule.
There are 15 pure blowout and 4 impure blowout fractures. Mostly it was assaults followed by motor vehicle accidents, boats and falls. In addition to the orbital floor, 4 patients had medial wall and 1 had a lateral wall fracture too.
The surgical repair. These are diplopia, great nocturnus, evident signs of entrapment.
It reduces instrument exchange and it should reduce blood loss and operating time. So, what's the aim of our study?
Due to an hypertension crisis in one following a trauma. In the trauma patient, the surgeon's duty is to perform an emergency cantolysis due to sudden visual loss and the patient recovered the vision. medical therapy for all the patients.
I think this meeting is well attended by experts from all over the world. Even though this is the European Congress, I'm amazed at how many people from all over the world are here. And that's to be, you should be congratulated for such a monumentous effort.
More than 500 posters were presented as e-posters on touchscreens and computers located in the conference area, and also available online at the conference website.
Members who have been checked against our database and those active members of the association who participate to the General Assembly, for accepting to scrutinize the EACMFS accounts and assets, and they will report back to the Secretariat. The ballot of the election of the executive officers and councils has been distributed. They will be collected and counted by Professor Testolin with her team, and we thank her again for the help.
Thank you very much. I think my report is printed, so I wouldn't take your time because we have a lot to do.
Enabling new colleagues to join the executive, bring new ideas. And
so there is still room to improve from good to excellent.
2 years.
The broad scientific programme and interesting social events with the opportunity to explore the beauties of Dubrovnik made for a very memorable week.
Excellent. The old city is like a Festung in German, we say, I don't know, a castle in English, you know. Everything. There are no bricks, they're just stones. And people are nice. I like it.
The medieval Revlin fortress, which guards the Dubrovnik harbour, was the venue of the gala dinner.